Welcome and thank you for attending today's webinar, Advancing Equity in Early Childhood Innovation, the final webinar in our 4-part series. I would love to thank our partners at Healthy Eating Research, in particular Megan Lott and Lindsay Miller, for their partnership in planning and hosting this webinar series. And before we begin, I just want to cover a few housekeeping items. One, we will be recording this webinar and sharing it publicly. We will also share presenter slides after the webinar. And you can submit your questions at any point during the webinar using the Q&A tool, and we will respond to them at the end of the webinar. Next slide, Janet. So just a quick introduction to Nemours and to Healthy Eating Research. Nemours Children's Health is one of the largest integrated pediatric health systems in the country. Everything we do, our medical care, research, education, and prevention and advocacy efforts is focused on kids. Our goal is to help children everywhere grow into healthy adults. And to do this, we think of health as more than just medicine. Good health involves education, food, housing, family stability, emotional well-being, equity, justice, and more. And that's why we go outside our walls to reach kids where they live, learn, and play. Our friends at Healthy Eating Research have a mission to support and disseminate research on policies, systems, and environmental strategies that promote healthy eating among children and advance nutrition and health equity. So a little introduction to Healthy Kids, Healthy Future. In 2009, Nemours Children's Health and the Centers for Disease Control and Prevention partnered to launch Healthy Kids, Healthy Future, a national movement to promote health and prevent obesity in children birth to 5. To support ongoing collaboration among experts in the obesity prevention and early care and education fields, we wanted to convene an expert group of national leaders from both the obesity prevention and ECE fields. And hence Healthy Kids, Healthy Future was born. We've hosted national conferences in 2009 and 2016 to advance policy, practice, and research in early childhood health promotion and obesity prevention. I'll turn it over to Megan now.
Great. Thank you so much, Allison. So through discussions with our partners at Nemours about the impact of the pandemic on the health and well-being on young children and families, we determined that there was a need for both the obesity prevention and early care and education fields to take stock and assess new opportunities to advance child health equity by better addressing food insecurity and childhood obesity. To foster this discussion, we developed this 4-part webinar series to share the insights of leaders in the space on how to leverage early care and education settings to achieve equitable health outcomes by highlighting opportunities and advances in policy, research, philanthropy, and innovation. We will share links to recordings and synopses of our 3 previous webinars in a follow-up email after this webinar. Next. During today's webinar, we will have short presentations from 3 speakers before moving into a conversation. Then we will open up the discussion to questions from the audience. Please feel free to submit your questions at any time during the webinar using the question tool. Today's speakers are Rochelle Pays, Project Director of Early Childhood and Health from Nemours Children's Health, Amia Oppenheim, Farm to ECE Programs Director, Associate of State Public Health Nutritionists, and Dahi Wolf, Senior Early Education Analyst from Kids Forward. Next. First, we will have Rochelle Pays kick us off, and I'd really like to introduce her. Rochelle is the Project Director of Early Childhood and Health with Nemours Children's National Office of Policy and Prevention. She oversees the CDC-funded Healthy Kids, Healthy Future Technical Assistance Program, known as TAP, which works to improve practices and policies related to healthy eating and physical activity in early care and education settings. At Nemours, Rochelle has supported several multi-year projects aimed at improving child health and well-being. She provides overall project direction and supports partnership engagement, strategic planning, technical assistance, and communication efforts. Thanks so much for joining us today, Rochelle.
Thank you, Megan, and thanks for the invite today. Excited to share our experiences related to embedding equity in early care and education settings and systems. Next slide, please. So preparing for today, I was thinking across all of our projects and activities. We've been doing this work at Nemours, mostly related to obesity prevention in the early care and education space for more than a decade. In more recent years, our work has really expanded to various programs and partnerships funded through federal cooperative agreements, private foundations, and state funding. To give you a quick snapshot of our work, we really work at the intersection of early care and education and child health. All of our work is done through partnerships, as you can see here, through this partnership with Healthy Eating Research. It is a core strategy that we use through all of our work. In early care and education, we are focused on embedding and promoting best practices related to nutrition and physical activity. As I mentioned before, our work started more than a decade ago in Delaware, and we've really scaled that up and spread it to states across the country. We have adapted the approach, improved it over the years, and responded to the needs of specific states and communities. We work at multiple levels, providing training and technical assistance directly to early care and education professionals in their early care and education programs and family childcare homes, but also work with state agencies and organizations that support those early care and education providers. Next slide. So today I wanted to highlight how we are enabling change in early care and education settings and systems, really looking at those levers that have been highlighted in previous webinars, research, policy, philanthropy. Those have all informed our work. And two innovations that I wanted to highlight come from our work under our Better Together project. We implemented family cafes with our partners in Arkansas with the aim of improving equity by focusing on improving social networks and family engagement. So really looking at how we could engage families, build their relationship with early care and education programs and providers, but also build that network of support between families around our topic areas of healthy eating and physical activity. At a broader systems level, we've also been promoting since 2018 equity, diversity, and inclusion at our with the aim of increasing state stakeholder capacity to address these areas within organizations that we partner with and how they implement activities. Next slide. So Better Together was a 3-year project implemented in Arizona, Arkansas, Indiana, and Mississippi. A part of that work included the development of an innovation. So our approach to innovation in this case was taking an existing approach and model known as family cafes. These have been around for some time. They're informed by the Center for the Study of Social Policy, Strengthening Families, Caring Conversations model. We took that model in response to what we were hearing in the field and literature reviews around the need for increased family engagement, took our topic areas around healthy eating, physical activity, created discussion guides, integrated that into the Family Cafe model. We also partnered with Tufts Medical Center and our local partner, Curricula Concepts. We layered on Tufts Healthy Outcomes from Positive Experiences framework, which includes building blocks of the different levers that really impact a child's experience, their relationships, their environment, everything that can inform a child's experience. And that was the overarching framework used for our family cafes. We helped develop the discussion guides, train facilitators for the family cafes, and then offered additional resources to early care and education programs in Arkansas to implement family cafes along with their efforts in our learning collaboratives, and also they were the work they were doing using the Go Knapsack self-assessment tool. In all, over about a 1.5 year period, we had 33 ECE programs in Arkansas that hosted 52 sessions of these family cafes. And they're really simple, facilitated discussions, and you can see the session topics there. The cafes were evaluated. We got a lot of feedback, and we heard such things that, particularly, this was peak pandemic, parents weren't even allowed to enter childcare programs for much of this time. So it was very challenging for them to build any kind of relationship with their childcare providers. But this was a way, and pretty simple way, for them to engage around specific topics, to understand what was happening around nutrition and physical activity in the ECE program, but also connect with each other. And it became a social network and a way to support families. They found connections through each other, just to really get through the pandemic, not only around these focus areas. But we heard from many participants in the cafes that because of the cafe, they learned about other families, other caregivers, and their community. They were checking up on each other during the pandemic, making wellness checks, making sure that people were taking time for themselves or getting out with their families. And so it was very successful in building those relationships and networks during a very critical time. Next slide. Here's a quick snapshot of just some family cafe resources. We created about a 1.5 minute video. It's an animated video just explaining what family cafes are, how you can host them and facilitate them. We will have a family cafe toolkit that provides sample discussion guides and just the approach of how to deliver a family cafe. You can also see the HOPE framework and a testimonial video from our partner in Arkansas. Next slide. Under our Healthy Kids, Healthy Future Technical Assistance Program that's funded by the CDC, we've partnered with the Institute for Public Health Innovation. We have provided in-person and then switched to virtual training on equity, diversity, inclusion with IPHI. And since 2018, we've trained nearly 300 participants across 16 states, and we're bringing on new states in this upcoming year. In addition to a 4-day intensive training for state stakeholders on equity, diversity, inclusion, we also provide follow-on TA. So it's not just the training, but our partners have access to IPHI and their expertise to really think through how to apply those equity concepts and strategies to their own organization. We have partners that have reassessed the power dynamics of their stakeholder groups, reassessed how they're issuing grants, resources, and make that a more inclusive process, and understand it and improve how they are compensating ECE professionals that serve on advisory groups and really compensating them for their time and expertise. This is something that we have continued to expand over the years, and our state partners have integrated a lot of these strategies into their strategic planning or multi-year plans. Next slide. So some quick lessons learned from these two examples. And this is something we remind ourselves and our partners that addressing equity is a journey. There will be missteps, but it is a process, something that we do intentionally, but also something that we have to be continuously improving. EDI strategies and approaches need to be promoted and supported within ECE programs, so the actual facility and systems, so that they can support each other. We found our family cafes were very successful in supporting social connections and networks at a very local level, and helped enhance family engagement between ECE providers and the families in their care. And that state agencies and organizations need ongoing support. We can't do just a one-time training. They really need that ongoing support through their equity journey. Thank you.
Thank you, Rochelle. Next, I would like to introduce Amia Oppenheim. Amia began working in early childhood with her research into the nutritional biochemistry of congenital disorders. Her interest in nutrition in early childhood eventually led her to the field of public health. Amia is currently a consultant and Farm to Early Care and Education Programs Director for the Association of State Public Health Nutritionists. Her work focuses on supporting programs and public health nutritionists around the country working to improve early childhood policy, systems, and environments. Amia has published and spoken widely on public health topics related to child nutrition, maternal nutrition, addressing childhood obesity prevention in communities, and guidance on public health coalitions. Thank you so much for joining us today, Amia. We look forward to your presentation.
Thank you, Megan, and thanks for the invitation. As she said, my name's Amia Oppenheim. Terribly cruel for any moderator to have to stumble through my first name. And I'm a consultant with the Association of State Public Health Nutritionists. And we focus on creating access to healthy eating and active living for everyone. And we do this primarily by helping public health nutritionists advance national, state, and local policy systems and environment change to improve health across the board. And we're really lucky to be involved and currently manage a large farm to early care and education grantee program in collaboration with our partners at the Centers for Disease Control and Prevention and the National Farm to School Network. And CDC is actually the funder of this work through a cooperative agreement with the focus on improving health and good nutrition opportunities in early care and education settings as a way to address childhood obesity and chronic disease. So we just started the 4th year of that program, and I'll describe a little bit about Farm to Early Care and Education and share some about that grantee program and how it looks now after 4 years. So next slide. So let me, I probably don't need to define early care and education to this group, but it is our catch-all acronym, at least at ASPHN, for everything that falls under early care in terms of, all the differences in childcare and how that can look, family, friend, and neighbor, family, childcare, et cetera. But let me spell out a little bit more what Farm to Early Care and Education is. When we say that term, we're really talking about a group of strategies that impact 3 aspects of early care settings, and that includes the education, the procurement, and the purchasing and serving of local foods, and the gardens. And the goal of these activities is ultimately to increase the access children have to nutritious local foods through that local procurement and purchasing, sometimes even through the gardens if they're sizable enough, increase children's opportunity for experiential learning through gardening, could be indoors, outdoors, increase what children learn about food, nutrition, agriculture, science through those educational activities that relate to the garden. And Farm to Early Care, it targets children 0 to 5, not just those pre-K kids, but really it can be adapted to all those ages. And it adapts also to really diverse early care settings and geographic locations. I've had the pleasure of interviewing childcare providers in remote Alaska doing a Farm to Early Care program, as well as really rural family childcare providers in Arkansas. So it can flex and bend to all sorts of settings. So next slide. Just to give you some examples of what it can look like. Within education, it's really about sensory learning. It's learning with your hands, learning with your smell, your eyes, your taste. It's learning about cooking and as well as math and science and also cultural literacy. It's really a potent tool to teach kids about their culture, about other children in the community's culture, and so forth. It includes local food procurement, and that can be serving local foods, local produce ideally, but it can also be all sorts of local foods and meals, snacks, taste tests, or even sending food home with family, which we've seen childcare providers start to do more and more. And it can also be gardens that take lots of different forms. It can be standard sort of container gardens. It could be raised beds. It could be a black sack in the classroom growing potatoes. It can take lots of different forms. So there's really no one defined program, but collectively they're considered farm to ECE activities. And that the goal of those activities together is to empower ECE providers, children, and families to make informed food choices while strengthening the local food economy and contributing to vibrant communities as well. Next slide. So I think one of the most common questions I get in this work is why we're approaching adult chronic diseases and obesity, whether it's in adulthood or adolescence, in early childhood. And I can't say this enough. I think there's so many reasons. I think the 5, standout reasons are really, there's a recognized pattern now in the US that children are gaining weight at younger ages than ever before, and they're not growing out of that weight like they used to, but carrying it into adolescence and adulthood. I think many of us are familiar with the study that shows that kindergarten weight is now a decent marker for weight in adolescence. So if you carry excess weight into kindergarten, you're more likely to be carrying that excess weight into adolescence and so forth. And that didn't used to be the case. So we need to shift our work younger. There's also several studies that show that interventions happening at these younger ages are effective, potentially even more effective than those happening with older children. And the effects of those interventions seem to be lasting. So when you measure them later, you can still see either those effects directly or even the beneficial echoes of those effects. So again, important to start early. And also this one's a bit more obvious, but important to state, young children have young habits. They're not entrenched from years of doing them, but we can impression those young habits more easily than we can with habits that have been around a decade or 2 decades or so forth. And also there's some data that suggests that preferences for physical activity and tastes are really most malleable in these early years. So the window for change is more open. Not to say that, children can't shift preferences, can't be open to tasting and trying and learning about new foods later on. It's just that window is a little bit more open when they're younger. And so it's really an opportunity to get in there and to have them tasting those foods so that they are open to them and continue eating them and selecting them. And then finally, there's obviously economic reasons. If we set up good health behaviors and habits at a young age, then, we reap the benefit both health-wise, but also saving a lot of money for individuals in the state and national governments in terms of health too. Next slide, please. Actually, next slide. Thank you. So that's where ASPHN got involved. As I said, we support public health nutritionists across the US. They typically work in state agencies. And in this work that we did with Farm to Early Care and Education with our grantees, we worked with states to identify a team of folks that included those public health nutritionists and state agencies and folks in nonprofit organizations, ECE providers, food producers, and so forth, to come together to try to impact policy systems and environment change to make farm to early care and education more accessible statewide and more successful statewide. And we were able to fund 15 states and territories, as well as some regions, some folks that were working on priority populations. In addition to being able to fund and provide technical assistance to those 15 states and regions and territories. We also were able to help 21 other states who were able to join us for webinars or training. So you can see in the dark blue, those are the states that we work more intensively with in terms of technical assistance and funding. And the light blue are those states that have joined us for some of the opportunities that we put out there. All right, next slide. So I mentioned why we focus on those early childhood settings. But I really also wanted to share why we focused in on farm to early care and education, because our goal was to improve an early care and education setting. And there's a lot of ways to approach that, but we focused on farm to ECE because the evidence is growing for this intervention. And I wanted to share some of those points. We're seeing with farm to ECE that the meals, in fact, in those ECEs that are adopting this practice and this intervention are actually better. There's data showing in Head Starts that they had healthier lunches with lower percentage of calories from fat, refined grains, et cetera. I'm not going to go into too much in the way of details, but the meals improved. There are also studies showing that farm to ECE really helps children try, choose, and even like fruits and vegetables more with significant increases. And more importantly, they're consuming more fruits and vegetables. There's a couple, very few, but a few control intervention trials that show that shift. So that's very exciting. And then there's some data that suggests that this behavior is not only happening at the child care facility, but it's also happening at home. And some data suggesting that it's shifting family eating behaviors too. And exciting research coming out of farm to school work shows that they're also shifting with their larger purchasing power. They're seeing a shift in actually the economics and the benefits of farm to school. By buying local, they're shifting those dollars into the community and improving the local food economy and employment. So, next slide. So that's a very brief overview of the work we're doing and farm to ECE, but in the context of this speaker series, I also wanted to include an important focus to the grantee work that we support. Like in all programs, policies, public health systems work, it's really critical that we address the social determinants of health. And to do that, we have to center this work in equity. And so over the few years that we've been doing this farm to early care and education grantee program, we've supported our grantees by providing trainings, access to those with lived experience, access to subject matter experts and researchers, readings, and webinars on investing their work in equity and centering in equity. And we've then put it back out to our grantees to determine how they're going to address equity. So creating an equity plan within their farm to ECE strategies. And they've done this in all sorts of different ways. They've done it through their collaborations, very similar to what Rochelle was describing, really shifting the power structures within their coalitions to make sure that when they bring new folks into the coalition that represent a diverse perspective, a diverse culture from what the standard culture of the other coalition members, a diverse geographic region, that those folks not only join the coalition, but they also have a very clear voice, a voice that's heard within that coalition. So they've developed ways and processes to shift power within their collaborations. They've also really worked on connecting to the communities that they're working in and the providers they're working in to build gardens and to reach ECEs within those communities, and to do it with the voice of the community and the voice of the provider. So not to go in with a turnkey approach that they should deploy, not change anything, but to actually go in and share some best practices, some ideas, and to work with providers and communities to adapt them to the cultural context of that ECE. And finally, they've also worked with farmers and purchasing to create farmers and markets and systems that really reach farmers that have been underreached in the past, and to focus on them in the local community. So, farm to ECE can really be a great vehicle to address equity. And not only that, but it's also sort of a public health hat trick, because it's a program where kids win, farmers win, and communities win. So it's the triple win of farm to ECE. We increase access to fruits and vegetables. We help shorten supply chains for farmers and provide them a bigger share of the dollar. And ideally, we also help communities win by having the money reinvested into local communities and really listening to communities and building programs within those communities. So, thank you.
Great. Thank you, Amia. So next, I will turn it over to Dahi Wolf. Dahi is a native of Ann Arbor, Michigan, and a graduate of the University of Michigan, and a former elementary school teacher of 16 years. He has been advocating for access to quality early care and education over the past dozen or so years with Kids Forward in Wisconsin. His particular focus is on promoting nutrition security and healthy food for kids 0 to 5 and their families. Thank you so much for joining us today, Dahi, and I will turn it over to you at this point.
Thanks. Thanks especially to Megan and Allison for hosting this, and I'm really pleased to be here. I couldn't ask for a better setup than what Rochelle presented and Amia just presented in terms of equity, in terms of farm to ECE, and the work we're doing in Wisconsin, which has been supported by their work. I'm going to basically share about two things. One is Healthy Early, which is our statewide coalition that's been around since 2008 in Wisconsin, that focuses on physical activity and healthy eating. And second, to talk about an innovation, a project that we did about a year ago called the Healthy Food for All, which provided food boxes to families in the two largest cities in Wisconsin, Milwaukee and Madison. 500 boxes a week in Madison, 1,000 boxes a week in Milwaukee. And so I'll start with a little bit about Healthy Early. We have been supported over the last 5 years by Nemours and the CDC, Healthy Kids, Healthy Future. So big thanks to that, because a lot of our work is, basically all our work is around collaboration and partners. And it only works because we're able to all work together and help each other with grant applications and with pilot projects and evaluation and connecting to national partners and all those sort of things. So I just want a big shout out to the folks that have supported us, the Kellogg Foundation, Nemours, and others. So next slide. Just as a quick example of what is Healthy Early, what have we done? We actually created about 10 years ago 2 different resources for childcare providers and families. And one of them was Healthy Bites, which focused on nutrition, and the other one was Active Early, which was about physical activity. And that's how we got our name. We combined the two resources. And we work closely. We've been doing Go Knapsack now for several years. We got to pilot the Farm to ECE component, which was really wonderful. And so we thank our partners down at UNC for that. And also, Amia mentioned the National Farm to School Network. We've gotten lots of support from them as well, and their move to go from not just K-12 as kind of things started back 20, 25 years ago, but really seeing the 0 to 5 space as super important. And I really appreciate that Amia gave the 5 points of why that is so key to our work and much more successful than later interventions. Next slide. So I'm going to talk to you a little bit about this Good Food for All project, and I thought I'd just start with a quote from a parent. We've completely changed our meal habits because of the boxes. Before, we would feed our kids separately for dinner and eat an adult meal later in the evening. Now we're preparing food from the boxes together and eating together. And I just really love that. I'm going to tell you, be really brief because we want to have lots of time for dialogue and questions and answers. I do have two colleagues that are joining me on this call from Wisconsin that were also involved in this pilot project. And so I'm going to call on them in a little bit to kind of give a little more, flesh out a little bit of this a little more. But I'm just going to real quickly say that this was a partnership. It was a year in planning, and then it was implemented over 12 weeks last fall, and then an evaluation was done. And now we get to talk about how cool it was. What was cool about it? Well, first thing, it was an amazing collaboration. I think the next slide might show that. Let's see. Yes, these aren't even all the partners, but it really took an amazing collaboration of folks that have been working together for many years and some new partners. That's one thing. The second thing is that we use the ECE system for the delivery of these boxes. This pilot was funded and arranged by the Partnership for Healthy America, which you may know of, Michelle Obama's organization, which does great work all around the country with hunger and lots of other things. But they were 22 cities across the US. We were the only state, Milwaukee and Madison, the only two cities that focused on early childhood education as a mechanism for that. And we're really proud of the fact that we were able to create an intervention with that policy, systems, and environment that was successful. There was a lot of doubt. I mean, we had to convince them that this was going to work because, as with a lot of folks, the ECE space is not familiar to them. It's complicated, it's convoluted, it's underfunded. It's a whole it's a whole steep learning curve to even know how it all works. And so they had to go on trust that we would make this work. And it never would have happened without the fact that we have a wonderful project in Wisconsin that's been going on for several years called our Shared Services Network. And so I was thinking that I would jump next to inviting Paula from the Wisconsin Early Education Shared Services Network to jump on and to talk a little bit about what it took to make this project successful. Can I have you jump on there, Paula?
Sure. So my name is Paula Drew. I'm the co-director of our Wisconsin Early Education Shared Services Network. In short form, what we do is connect independent childcare providers, both home-based and center-based, together within this network to leverage shared staffing, shared resources, and connecting to food systems work. So this project for us was a good fit. We had an engaged network of providers in both of these cities in which we interact with on a regular basis, which I think was that sort of like convincing factor with Partnership for a Healthier America, that we do have a connection to the independent business owners, childcare providers, which on their own would be difficult to, try to interact with 44 different childcare providers. But because of our network and our existence, that part was a little bit easier. And then for us, it was really figuring out how are we going to move all of these boxes of food. So I did some quick math, Dahi, while you were talking, and over the course of those 12 weeks, 18,666 boxes of food was delivered, which amounted to 1.141 million servings of fruits and vegetables that were distributed. And for us, it wasn't, it was sort of like these boxes were benefiting children and families at their homes. So they were going home with kids each week. They were also benefiting early care and education providers, teachers in those classrooms who face food insecurity and also have families. And then it was also being utilized at the childcare program so that kids were getting that consistent nutrient dense food both at their childcare environment, in which sometimes they're eating 3 meals a day, and also at home. So that part we had well done, connected to these providers. We understand the field. We're all from the field, but we had to figure out how to move these boxes. And so we reached out to some partners at Feeding America in Milwaukee, and they helped us think through things to consider when you're even transporting heavy loads of anything. And we were connected to a local Milwaukee transit company called American Transit Team, who were really excited about giving back to the community and doing something meaningful with their work, which was great because they also took a chance on us. They don't normally do this type of delivery stuff. They normally actually transport people, but they really understood the mission and they were excited about it. And then it was just a whole lot of logistical planning. How many families from each of these 44 programs wanted to participate? How many boxes were going to need to go to which place each week? And this was during the height of COVID, right? This was 2021. So there were weeks when a childcare program was closed due to COVID exposure. And then we had to reconfigure the whole transit plan, and also how to gleam or repurpose the boxes that couldn't be used that week. So found community partners in each city that were willing to take those boxes in and ensure that they got into the bellies of folks in the community in a different way. So happy to be a part of the project. I think it was really meaningful. We actually just heard from a childcare provider last week that said, parents are asking, are we doing this again this year? We'd really like to, participate again. So it was a lot of logistics, but I think it made a big impact.
Thank you so much, Paul. I think that was really helpful. And we're going to keep you on for the question and answer in case people have more, specific logistics or thoughts about, how do we do this in Arkansas or in Alaska? Yeah. All right, I'm going to segue into a little bit about Healthy Early and our work in diversity, equity, and inclusion. So as Rochelle pointed out, the Institute for Public Health Innovation was a partner that worked within the Healthy Kids, Healthy Future states that were wanting to do racial equity. And so 3 years ago, it was the summer of 2019, we had our trainers come to Madison for 2 full days working with our coalition. And it has been extremely helpful and meaningful. And having that training, as well as having funding to support making this work in terms of hiring consultants, paying participants in terms of stipends, and just having the staff time and the space to make this this transition. So we basically took this coalition that's been around for 14 years now, that had a policy of only having people on the steering team that were representing statewide organizations, either state agencies like health or children and families, or nonprofits like Kids Forward or the Wisconsin Early Childhood Association. And then realizing that we wanted to just kind of throw out that whole thing and start over. And so we went inside out. We took all the current leaders and put them on the outside, and then recruited a group of leaders from local communities who represented a diverse group of voices, and invited them to basically be at the center of the power and the decision making. And that is what we've been able to launch. We had our very first Healthy Early Leaders meeting in September, and we are moving in the direction that we've been trying to get to for 3 years now, and it wouldn't have happened without the support of Nemours and the folks at IPHI and the commitment, of course, of all our, current and future participants in making this happen. People bought into it and knew that it was the right thing to do. And I think that for the most part, that's the case everywhere. It's more like, how do you make it happen? What are the steps? What does it take? Do you have funding? Do you have support? Do you have time to do it? And we're still on the journey. I mean, like I said, we just had our very first meeting, but we have a plan to move forward in the next few months to actually have that new group of community leaders reflect the actual needs of the communities who we work with as we set our policy recommendations, as we move forward for what our priorities are for the next several years in Wisconsin. Amy, my partner on this work, who provides the backbone support, is on the call. I just would like, Amy, is there anything you want to fill in about Healthy Early and this equity-focused process that you can share with people before we move to the Q&A? So, Amy, are you on?
Yes, I am,
Thank
Dahi.
you.
I have not much to add other than a couple of key things that we've learned on behalf of Healthy Early over the last 3 years is, number one, this will move at the speed of trust. And two, belief that communities are closest to the solutions, and really focusing on these beneficiary voices, parents, caregivers, ECE providers, and really shifting the power to them has been a really powerful experience for those of us involved. And we're learning a lot along the way. We're learning we have to have things translated into Spanish. We have to have a way of compensating these leaders for their time and their talents and their feedback and their advice. And we're really grateful for the last 3 years and the support we've received. And we look forward to continuing to learn lessons along the way. It's been a very powerful experience for everyone involved here in Wisconsin. So we look forward to learning from how other states are doing this and sharing our lessons learned as we continue on this path.
Thanks so much, Amy. Well, I think I'm finished with my part. Is there one more slide? I can't remember if I had one about. Nope. Okay, we're ready to move on to questions. So thank you.
Great. Well, now I'm going to invite Amia and Rochelle to also come on back on camera, as well as Allison and I are going to facilitate a little bit of a discussion before we start taking questions from the audience. So please do not forget to submit your questions using the Q&A function on your Zoom toolbar. But I'm going to kick us off with a question to Rochelle. And the purpose of this part of the conversation is really just to dig a little bit more into your work and your thoughts on opportunities to advance innovation and equitable approaches to food security and obesity prevention in early childhood. So, Rochelle, can you talk a bit more about the innovative strategies that partners in the Healthy Kids, Healthy Future TAP program and Better Together program are using, such as family cafes, and how have these approaches promoted engagement with families?
Yeah, sure. I think something that we have been excited to see through this model, through Healthy Kids, Healthy Future, but also Better Together, is that the innovation really happens at the community, at the state, at the program level. We have really adapted our approach over the last 5 years. We provide training support, technical assistance. We really partner at various levels. And that's where the innovation comes through. Like, we support the innovation, but we don't impose it. And we've really seen that, we might provide an assessment tool, whether that be, Go Knapsack, and provide training on it, or a local tool. But the innovation really happens at that program level and what a provider does and changes in their practices and policies. And even the idea around family cafes, we sort of had the broad brushstrokes of what it could look like. And we found in Arkansas just things that we wouldn't have imagined when we came up with the model, that it was a way and we're probably seeing more of this with the pandemic, there are a lot of grandparents serving as parents, and it is very hard for them to connect with other caregivers. Everything is sort of set up for mom or dad, but to be a grandparent, it's hard to connect to that network, to meet other parents, meet other grandparents, other caregivers. And so this family cafe became a way for them to connect to other families. And they're still connecting with each other with the conversations. So it really is, I think, building what Dahi brought up and Amy, is that it's really at that local community level. And we see our role at Nemours is just highlighting that, lifting it up, and helping that spread to other places.
Great, thanks, Rochelle. Turning towards Amia, can you share about how ASPHN is supporting farm to ECE grantees in integrating innovative practices into their work? What innovations are your partners finding to be the most effective in really promoting early childhood health?
Yeah, I was appreciating what Rochelle was saying. I mean, we do focus at the state or regional level, but definitely that idea of providing information, resources, and then agency to let that state or region go where they're going to go with this work has really been fruitful in our work as well. So they're doing it with the providers. We've seen it with the states, and we've seen a lot of innovation, and those innovations have strengthened farm to ECE and therefore promoted early childhood health. So I can provide examples of that. And the role of ASPHN has really been the promotion of the work that folks are doing so that other states can pick up that work and run with it and then do their own innovations. But some examples of that have really been, I think, primarily around the procurement piece. So the purchasing of local foods can often be very tricky for childcare providers. For so many reasons. And so it's a piece that we work on a lot within our grantee program. It's a piece that we talk to our states about to try and hear what they're struggling with, what they're succeeding with. An example of two pieces of innovation in that area that have been really exciting is in New Mexico with our grantee program there. They've been able to use the FIG funding, the Farm to ECE implementation grant that we fund and provide TA for, we call the FIG. And they've been able to use the funding from that program to incorporate their early care programs and their aging programs into a statewide local food procurement system that's called New Mexico Grown. And so this system allows early care and education providers to tap into and identify farmers that have the foods that they want, that make CACFP reimbursement, the child and adult care food package reimbursement, a little bit easier. So basically, they're working on a system to just make local food access simpler and more accessible for childcare providers. Another great example of that work happening is in Iowa, where they took the FIG, our grantee program funds, to pilot test a child and adult care food package, a CACFP reimbursement program, so that ECE providers that were doing CACFP, that child, I'm so not used to spelling out that acronym, I'm sorry, that child and adult care food program, ECEs that were enrolled in that would get increased reimbursement for the local foods that they served. And so they piloted this around the state, and they just saw great success and actually got state attention. And now they're getting funding to expand their farm to early care and education work as a result. So lots of innovation, especially around procurement.
That's really exciting to hear about that, the investment of state dollars that can be so hard to really make actually happen. So really congrats to you and your colleagues in Iowa and getting those changes passed. Dahi, can you talk a little bit more about the Good Food for All food distribution program in Wisconsin, and specifically thinking about how you and your partners work to leverage the ECE system to distribute the healthy food boxes, and what innovative approaches did you all really incorporate into the program and impacts you have seen?
Well, first of all, I want to say this didn't come out of nowhere. I mean, we've thought for a long time about the fact that, ECE programs are actually closer to families than, say, the K-12 system, and that it's an ideal environment. I mean, the families pick up every day. We know about programs that have hosted, been sites for CSAs, for community supported agriculture, where families can participate and pick up their weekly boxes if they're part of that. And we know that there's just, there's so many ways that families and ECE connect, and in terms of, learning about healthy eating, participating in gardening or community meals, or, all these different ways. So I just want to say it came out of the fact that we already knew this was a good partnership and an ideal way to do things. And like Paula said, it could not have happened without the fact that we already had existing structures. So like I said, it did take some convincing to get PHA to buy into this, but I think the results prove themselves, and we feel like, we pioneered this, and now maybe somebody somewhere else can build on that and say, guess what? It worked in Wisconsin, so we can do it. But on the other half of that is that the logistics are through the roof. And we know that the transportation, the cost, that storage, that, food prep. I mean, there's so many issues that K-12, has down and ECE doesn't. And so, just really want to point that out, that yes, we made it work, but it was a huge cost, and it was a 12-week pilot. And it actually kind of pointed out how difficult it really is. I do want to share a current pilot that is happening around food hubs and getting local healthy food to centers. So Amy or Paula, do you want to talk a little bit about what our partner Becky is doing? Paula, why don't you start?
Yeah, I think our new project working with Wisconsin Food Hub is sort of an iteration of what happened after the Good Food for All. And that was really us forming a relationship with a food aggregator and getting childcare programs connected to transportation routes that are already existing. So this food hub is already making deliveries across the state and doing light processing of fruits and vegetables, as well as aggregating other sort of value-added food items, cheese, syrups, different things that farmers in Wisconsin are producing. And for this project, we knew, there was a few things, like Dahi said, the logistics managing was difficult with this project. And also we wanted to start with a provider. So we gave them a list of all of the different types of produce that the food hub could gather. And we said, rank these in terms of what you would prefer to have in a box. So we started there and we whittled it down to a manageable list. And these boxes went out weekly that were lightly processed to the childcare provider. So we sort of scaled back a little bit from the food going to the families and the providers. This project is just focused on the childcare providers. It's lightly processed. It's food that they are excited about, that they know what to do with. And actually, we're in our second round of this project. So we did a pilot. It worked exceptionally well. Providers were really, really excited. They sent beautiful pictures of the food that they were cooking and just the boxes themselves with the produce in them, because they were just so lovely. And now we're in a second iteration now that's expanded. The territory is still connected to transportation routes that are already existing, but we're working on a third iteration that will actually expand some of those transportation routes to essentially do the same project to the southern half of Wisconsin. So 20 counties, childcare providers. I think this is a total guess, but I think it's about 74 childcare providers that will be in this participating in this third iteration. So really getting back to that, that participant, what exactly is it that they need? Is it aligned with CACFP? That's super important to us. Understanding the implications of that for childcare providers and making it as easy as possible, delivering it to their doorstep and giving them some added information. Here's recipes that you can use with this produce that follows the CACFP recommendations. So just sort of, including everything, the feedback that we got from the Good Food for All project, feedback that we continue to get from providers to make it as easy as possible for them to be able to use this local nutrient dense food.
Thanks, Paul.
So before we jump to the next question on the list, which, Amia, you're on deck. There is a question that came in from the audience for our friends in Wisconsin about how can others replicate what you're doing? Do you have toolkits or tip sheets or something available to help replicate what you all are doing?
I don't think we're quite there yet. I would say that the most important thing is the partnerships, because you can't make any of this successful without establishing those trusted and collegial relationships. So I'm going to say, that's what's made this successful. I do, also fighting for what you believe in. I mean, when PHA approached us, they were suspicious of the idea of ECE being a successful network, and we convinced them. So even though we don't have, a ready to go toolkit, we'd be happy to get on a call or, consult or make connections. I'm sure the folks at PHA would love it if other states were like, hey, we heard about this thing in Wisconsin. How about you do another one? So I don't know, Paul or Amy, any ideas about that?
I do know there's a number of different shared services networks across the country. Definitely there's a strong one in Arizona. I can put a link in the chat box that maps them all. I do think they're an excellent intervention point for different projects because they have that that established trust with childcare providers. So I'm biased, right, as a director of the Shared Services Network, but I do think it's a really wonderful place to start when you're working with individual ECE providers. So I can find that link and put it in the chat box.
Great, thank you. So back to regularly scheduled programming. Amia, you mentioned that ASPHN works to help public health nutritionists advance state, national, and local PSEC to improve health. How does that work for Farm to ECE, and what are the policy systems or environmental changes that you work to promote?
Yeah, so our role is to identify what states are doing in terms of shifting policies, systems, or environment, and to identify those that are the most effective or sustainable or innovative, and to promote those. And to also help other states or groups that are interested adopt the work or adapt it or fund it in their own state. And I think probably the best example of this is we were seeing over the course of our funding, we kept having a start stop with our funding. We didn't know we were going to get a second year, so our teams were kind of winding down and trying to shuffle and find funding from somewhere else, and then surprise, we had funding again. So we did that a few times, but each time the teams were shifting to really creative places to pull in funding and actually created sustained pathways of funding. And so we were watching that happen and seeing them put them into federal grant resources, to state policies, and creating positions for Farm to ECE that were funded, or creating funding streams that funded professional development long-term. So we actually put together and I can share this link too if desired, but we put together, along with FRAC and National Farm to School Network and Policy Equity Group, ASPHN did this with our partners, a guidebook of like all the different places that we were seeing states turn to integrate funding long-term for farm to ECE. So that's an example of our role and what states did as well. But I can put that in the chat.
Yes, please do feel free to share any resource links in the chat for attendees. That would be wonderful. I'm going to turn back to Rochelle. Yeah, I'm going to turn back to Rochelle and ask you a question about the systems change work of Healthy Kids, Healthy Future, TAP, and Better Together supports ECE providers in adopting best practices and innovative practices for addressing food security, nutrition, and physical activity in ECE settings. Can you talk a bit more about that?
Sure. That was a lot. But I will say what has really helped us and our partners across both projects, Healthy Kids, Healthy Future, TAP, and Better Together, is that we use a common framework. So we have been using CDC's Spectrum of Opportunities, which highlights the different systems levers. And so that has really helped. It gives it a lot of credibility that's from the CDC. We've been using it with the states that we work with through the CDC work, but also our other work on state recipients of SPAN funding, so that state physical activity nutrition funding directly from the CDC also use that framework. So having all these state partners use this framework, and they can systematically go through and think about how to integrate these best practices into professional development, into licensing. Farm to ECE is a part of it as a statewide access initiative. So really thinking through each of those, and they have been successful in using that to bring their partners together across all of our states. What's been helpful about the framework is that different state agencies and partners see themselves in that framework, and then they start really thinking through how they can collaborate to improve and create healthier childcare settings and what their agency organization can bring to that collaboration. So that has really driven our systems work. It kind of gives them this shared language, shared framework once everybody starts getting familiar with that and they see their role in it. So I think that has really helped us move forward. I sometimes think about how would we do this work without the framework? And I think it would be very challenging. So I think that having that framework that people can also customize and focus. We've had states that go really deep in 1 or 2 areas. We've had states that focus in 4 or 5 areas over the years. And everyone also starts out with the understanding that the systems level piece takes a lot of time, a lot of years. So we've been fortunate to be able to partner with organizations like Dahi and Amy's group in Wisconsin for many years to support, and we're starting to see, amazing changes at that systems level.
That's great. And Amy, did you want to add anything from the Wisconsin perspective real quick?
Sure. Rochelle, just building on what you said with the framework and working at a systems level, some really important lessons learned from Wisconsin are how important it is to spend time learning the different systems. So we've spent a lot of time understanding the early care and education system here in Wisconsin, the key partners, how the flow of information goes to providers. And likewise, the ECE partners have started to learn public health terminology like PSC change. And, for us to be able to show them that CDC framework and explain it, there's just been a lot of time spent building that shared understanding. And the beauty of that is that now we have all of these alignment opportunities to move big things. So, we spent time educating our Department of Agriculture farm to school coordinator about early childhood. And she spent a lot of time with our colleague Becky at the Wisconsin Early Childhood Association learning about all of the challenges that EC providers are facing. So now we have someone at the state agency thinking about these things, and as all these amazing USDA grant opportunities are coming in, by the way, right now, she's thinking about that and thinking about the systems changes in the supply chain and how it's going to have to shift to accommodate early childhood providers. So honestly, it's like the secret sauce in systems work, is like that shared understanding and really spending time understanding these different systems. It becomes really clear the key partners, the change agents you're going to need to move things. And, of course, trust is really critical in this too. But that's been the beauty of what we're seeing, is that spending time on these relationships, these partnerships, understanding it from a systems perspective is starting to pay off.
I just want to add one quick thing, which is that with PSE, I am a big advocate of the fact that big P policy and that little P policy is at least as important or more important than big P policy. And a lot of the work we've done, like we said, is at that local community program, family level, and that, promotes change, from the bottom up. And sometimes that's even more effective than top down, let's say edicts. No, that's not a good word, but you know what I mean.
Great conversation. And so let's change a little bit, pivot a little bit. And Dahi, this is for you. You talked quite a bit about equity lens in your work. Can you talk a little bit more about how you've operationalized an equity lens in your work, and what have you learned from the process?
Well, first of all, I'll give another shout out to Nemours and the Healthy Kids, Healthy Future, because we have had a community of practice around equity for the last, year or two now, which is super helpful to have a shared experience and share resources and, talk about it and feed off each other. And that's, to me, is so important. Second is the intentionality of it, of putting it right out there in bold letters. We talked about for years, we go back and forth on like, okay, is equity a separate priority that we put here, or is equity a priority that gets embedded into every other one? And we keep going back and forth. And I think the real answer is both. I think you have to just think of it all the time, or else it won't happen. Institutional racism and the history of our country and food systems and health systems are so stacked, against, health, what we want, which is, people in all communities to have a chance to lead a healthy life. That, we just have to fight extra hard for that. I think part of that intentionality is funding, is, looking for grants that are going to support your work, and just being, really clear in your goals and your policies that, that we are, and that's actually a place where that little p to me is key, because we've been able to target our interventions to, families of color, to low-income families, to families in rural areas that don't have much service. So that's intentional. That's not going to happen if we just didn't make that a priority. So I think, Allison, those are a couple things. I want to say that the hardest thing right now is that our funding sources are all very uncertain. We know that the CDC 5 years of funding the Healthy Kids, Healthy Future is ending next summer. We don't know if it's going to be continued. We were very lucky to have Kellogg be we were one of the 5 states that Kellogg funded to do this for the last 6 years. That's ended. And then with like Paula's work and a lot of other things that's getting federal rescue money, CRSA and ARPA and stuff, we know a cliff is coming up in a year or two. So it's kind of a scary time in that sense. Like, we're going to build all this stuff, and then how are we going to pay for it? So if anybody has any ideas about that, and to me, that's an equity issue.
Yeah, I think that's a really important big question, is how do we ensure that some of these really amazing innovative practices can continue to grow and be scaled up and not end when the funding really does disappear, and definitely something for us to think about more in future discussions as well. I want to build on that a little bit and hand over a similar question, Amia and Rochelle, to you both. Can you talk about how you are supporting grantees and partners applying an equity lens or embedding equity into your work through ASPHN and Nemours as well?
Sure, I'll jump in there, especially after Dahi set it up so well. I think we wrestle with the same question of, is equity this piece over here, or is it to be integrated into all the different pieces? And it's to be determined. But certainly, I think each of our teams has been addressing equity within different aspects of their work. So we have the different pillars of work that I mentioned within Farm to ECE. We have the purchasing local foods. We have the educational approach to learning about agriculture, nutrition, and food. And we also have the actual gardening, the hands-on. And then we also have the coalition that supports and progresses the work. And so we've seen grantees given, some resources and some training. We've seen them integrate it in all different ways, and usually a comprehensive approach. I think a nice example I could pull from is in Minnesota. They worked really conscientiously with a lot of partners over the course of a year to create a mini grant program that had the accessibility to reach really everyone in Minnesota. And they did that through where it was promoted, who was sending out the emails, the languages that it was translated into, the mini grant opportunity was translated into, the requirements of the mini grant, what the provider had to deliver was shifted depending on the communities that you were in to make it, less of a barrier if you weren't necessarily a provider with citizenship. And the list goes on and on. So they've been adapting their mini grant very thoughtfully and really looking at what is the outcome? Are we hitting the mark? And then, shifting it to get even further into those communities that typically don't get those kind of opportunities and aren't able to sustain Farm to ECE because the funding's just not there. Another example, sort of looking more at the coalition side of things that support the work, our grantee in Washington, D.C. had really recognized a gap in their coalition to do this work. They had this large coalition of state agency folks and nonprofit folks in DC, but they lacked, any food producers or providers, and felt like those voices were really missing in making Farm to ECE meaningful for the people that they were serving. And so they funded providers to join in that coalition. And it was initially kind of a failed experiment in some senses, because those providers joined and were completely silent for the 6 months of meetings that they had. But it wasn't failed in the sense that they immediately, the grantees took restock, they talked to us, they talked to other folks with lived experience, subject matter experts, and they retooled it and they created 2 coalitions, and one serving as almost a learning collaborative or a community of practice of providers that they put questions to, they gather information from, they work with, they provide training for, and they're also working with them to develop their skills to actually lead coalition meetings and polling those providers to see if they're interested in integrating back into that larger coalition with the end goal of having those providers come back in and start leading those larger coalitions, really empowering them to have a voice and participate in those statewide or territory-wide meetings.
I would just add to that. I think, applying an equity lens, it's very much speaks to what Dahi mentioned of, having an intentionality. So I think we, from my team and Nemours and how the support we provide to states, have tried to be very intentional about it and weave it into everything that we do. I think we do both. Like, we try to have a very specific focus. We have things like the community of practice. Our own team has done trainings on equity and participated in other communities of practice or webinars. But then we're also reassessing how we do activities that we have done for a long time, or that we provided technical assistance on for some years. And an example is that recognition programs. We've been asked for many years to provide support and technical assistance, different departments of health on recognition programs. And, we scanned the literature and saw, like, these are the general parameters of recognition programs, and everybody's comfortable with ranking programs, gold, stars, ABC, 1, 2, 3, whatever ranking. I think in general, everyone's comfortable, with stars, and we have ranking and Yelp and all kinds of things in our lives. So it makes sense to everybody. But really having that intentionality, we've seen in the last couple of years that those programs are reassessing, because we're just promoting more inequities by saying, well, these are gold programs. And if you're a bronze program, you might not want to be across the street from a gold program. Like, this affects your business. So really thinking of, that recognition program is part of the spectrum of opportunities, is something that a lot of states are interested in. But what is it doing around equity? It's actually, is it promoting equity? Is it not? So we're starting to see more states change that ranking and really thinking about progress and change, and just even programs participating in quality improvement versus, just achieving some ranking and being recognized for that ranking. And we've also seen that around quality rating and improvement systems and broader early care and education. And, people in the field have been calling out those programs, they're promoting racist institutions. And so we've been seeing in the last couple of years just a real change in how those are designed, and what are the implications for equity.
Great. So we are now going to do one speed round to all three of you. You have about a minute to answer this. So in your crystal ball, looking forward, what do you think are the greatest opportunities for advancing progress on achieving equitable outcomes in early childhood health? What is the one most promising innovation or strategy that we should be thinking about scaling? We'll start with you, Dahi.
Okay. Well, I would say that something that really excites me about this area is childhood mental health, talking about restorative spaces and the role of physical health in folks dealing with trauma, and that we know the research is out there, and we know that the need during the existed before the pandemic, but it's gotten even worse. And so I think that to me is a really great opportunity to leverage public interest, family needs, politicians, and hopefully funding sources to see this as a strategy that is actually integrated to help the whole child grow up and have a healthy and happy future.
I can go next. I would say something we actually didn't talk about today, but we've had a lot of interest and great work from different states, is outdoor learning. I think it has amazing implications for equity. I think there's a lot of inequity on how outdoor spaces, natural spaces are used or not used in some communities, or not promoted enough. And so to me, like, my crystal ball is where I would like to see more investment in that area. Yes, and I love that it's Olay. So I think that's an area that has a lot of space to address equity and innovation. I think there's ties to physical activity, social, emotional, and the food piece, because it's actually, food grows outside. So just promoting that in the early care and education space, I think is something just really exciting. I would love to see that grow across states and communities.
Yeah, I would say, well, certainly I agree with both of what you all said. But I also think really building the child and adult care food package to make it truly accessible for all early care sites. So, in terms of making the paperwork feasible in terms of volume and readability, and in many different languages, making it so that you don't necessarily have to be licensed to be able to access the program. So friend, family, and neighbor can access the program. Supporting sponsor programs so that they can geographically be around a state, even in the most remote areas. So I really think it's critical in terms of food access, to make CACFP more accessible. And of course, build farm to CACFP right on the back of that. So.
Great. Well, thank you to Dahi, to Amia, to Rochelle, also to Paula and Amy. This has been the fourth webinar of a 4-part series. So I also want to take the time to thank Lindsay Miller from Healthy Eating Research and Janet Viveros from Nemours Children's Health for all the work that they have done behind the scenes. You see Megan and I on these webinars, but they certainly would not have gone forward without the hard work of both Lindsay and Janet and the tech team at Healthy Eating Research. So just wanted to thank them and to thank all of you for tuning into today's webinar. We will be following up soon with a recording and slides from this webinar. And additionally, we will develop a synopsis of key themes from today's conversation that we will release in a few weeks. And you can also get caught up on any of the other 3 webinars you may have missed in our series by reading their synopses or checking out the webinars themselves. We'll send links to them in our follow-up email. So thank you all to everyone and have a great day.